on a, in a practice setting where it's a, interdisciplinary, interprofessional team, but even just communication with other treating professionals. The information that we have in the record is available to us to be able to share when relevant and needed, as opposed to trusting our memory. And then in coordination of care, again, I've seen where, the transfer of records is part of transferring a client to a new treating professional. That can be helpful. Or, looking at specific treatment needs. And again, this issue of continuity of care and obviously not having to start all over and repeat things. I think most patients or clients don't like having to answer the same questions over and over. And even for us, to review the record helps us to remember what did we do last time or recently, and what did we say we're going to do, so we don't forget to follow up on things we said we were going to do. 6 days to document. I think you're going to have forgotten so much. So much has happened in 6 days. How many other clients have you treated since then? How can you keep it all straight and remember everything? So this is not a requirement, what I'm about to say, and is not the standard you must follow, but I'll tell you what I do. I take notes during my sessions with clients, and I explain to them up front that, I'll be jotting some notes while we're meeting, and I explain why I do that. Because if I'm sitting there thinking, oh, that's important, you have to remember that, don't forget that, I want to remember to document that. If I'm trying to remember something, I'm not focusing on them. So if I just jot it down, great, I can free my mind of it and I'm focused on them. And so what I do during the session is not the actual documentation that will happen, but I jot down some notes during a session. And again, my clients understand why I do that. And I've had clients sometimes say, what did you just write? And I'll say, clients report, decrease in symptoms of depression, or client states, I'm feeling so much better, quote, end quote, than last week or whatever. But, you really want to be thinking in terms of, if someone reads this, it's like, can they picture what transpired? Can they see it? Making progress. Really, what progress? Over what period of time? In what aspects of their functioning? To what extent? And what's contributed to them making progress? In response to what? And again, continue with plan. Way too vague. What is the plan? What are the specific goals? What are we working on? And again, even in this session note, what was the time of the session? When did it start and end? Was this for a 2-minute meeting or a 90-minute? Anything about the relationship and the interaction, prognosis, which one person asked about, assessment or summary data, any findings, scores, things like that. For clients completing a dysfunctional thought record and bringing it in each time, I'm keeping a copy of that in the file. I have a record of it. So, anything that impacts the treatment decisions I make and the services provided, to include individual differences and diversity factors that might be relevant. And then obviously confidentiality. So do you have office policies and procedures? Do you train your staff? Do you provide appropriate oversight to your staff? Just because someone's a receptionist or can type or file or things like that doesn't mean they're familiar with the mental health professions and the need for confidentiality, and then how physical records are stored and who has access to records.